In this section, we're going to finish our discussion on positioning. We're going to look at full mouth radiograph series on a cat and also go to the other extreme and look at a full mouth series on a large dog. We're also going to discuss templates, and we're going to give some tips and tricks along the way that should help you to facilitate full mouth radiographs in these two circumstances as quickly as possible and minimize anesthesia time.
Hello, I'm Brett Beckman, veterinary dentist, here to describe full mouth dental radiography in cats. When we position our patients, we position them in sternal recumbency initially to image the maxilla. And as you can see here, we're placing the sensor in the right caudal maxilla. Our angle for our tube head is generally about 30 to 35 degrees in this particular view. For the right maxillary canine, we position the tube head at the angle shown and generally place it at about 60 to 70 degrees, as you can see here. The incisor view is imaged using the same technique with bisecting angle at about 45 to 50 degrees. The left maxillary canine again at about 60 to 70 degrees. And back to the left caudal maxillary cheek teeth. Again, we shoot that at about 30 to 35 degrees, getting up under the zygomatic arch, slightly elongating the image, however, eliminating the superimposition of the zygomatic arch over those maxillary canine teeth. We undo the endotracheal tube to reposition the patient in dorsal recumbency for all of our mandibular views. And as you can see, we extend the head slightly to try to recreate a parallel arrangement between the mandible and the table. Now for the first shot, this is one place in the mouth that we can actually do a parallel technique versus the bisecting angle technique that we performed on the maxilla. You can see we're shooting directly at the sensor and producing a parallel image. Moving on to the lateral view of the canine tooth, we generally shoot that at about 60 to 70 degrees. That also gives us the third, fourth premolar, and sometimes the mandible, the mandibular first molar. Move on to the incisors at about 45 degrees, and then back to that other canine at about 60 to 70 degrees. Finishing up, we repeat the parallel technique on the right side, as shown here. And that completes our full mouth series on the cat. Looking at our image directly here after we're finished, you can see that all of the images are in the template correctly. Correctly meaning exactly as if you were looking at the patient.
Hi, I'm Annie Mills, licensed veterinary technician with a veterinary technician specialty in dentistry. We're here in Atlanta working on one of our patients, and we're going to start our full mouth series as we do with all of our patients. Once we get them anesthetized and they're in sternal recumbency, we do that first. So we always start with our patients positioned in this way, where we've got them in sternal recumbency and towels underneath the chin in order to get this maxilla parallel to the horizon. This is going to really eliminate a lot of the guesswork and make the angulation easy for our images that we need to use that bisecting angle that can be very confusing. So if we get our maxilla very parallel to the horizon, then we can use these numbers on the side of our tube head. And so there's no guesswork. And with Dr. Beckman's radiographic positioning guide, all of those angles are listed in there for you, and so it makes it much easier.